being treated because they had a smaller fare. So that was problem number one. Problem number two is hospitals now are like, okay, I have this really huge bill. Who wants to pay it? And nobody has really wanted to. The central government and the national government every now and then are pulling money and saying, okay, here's your money, please keep running. But irregular migrants are really putting a strain on the system, and we have not properly devised financing mechanism for the expenditure that they're causing. So the central government has set these emergency decrees. A new decree came out, and it said basically that subnational governments, if they feel like it, may use some funds to pay for that, and the central government may also pay for that if it feels like it. But we'll see how much it is. We'll see how much money we have in a few more months.
Okay, it looks like challenging for the government, also because of the incentives that the EPs have right now. So we have read in the news that Colombia has requested the international community for help to face the crisis. What has been the response, and what is the effect of the resources available to the healthcare system?
So that's a really difficult question because it involves a part of the government that I'm not currently involved in. So I don't know how the government has fared in terms of getting donations. But what I can tell is for everything health related. So the central government, when the pandemic hit, we had a lockdown, and the central government said, okay, we're going to have to spend a lot of money into different programs. Some of them are health related. Some of them are related to employment programs. Some are thought to, cash transfer for people, all that. What I can tell is for the health system, we did come up with somewhere around 7.2 Colombian trillion, which would be around 0.7% of the GDP. And I really, that's the part that I said, I really do not have the detail of how that money came from. So I don't know the exact source.
To finish, I would like to ask you, do you think the current situation demands for any type of reform in the healthcare system?
We have made quite a few. The way in which the Colombian government works is the Colombian government, if the situation deems it to, can decree a state of economic emergency, right? And if you're in an economic emergency state, which the constitutional court then reviews whether you really had reasons to decree one. If you're within that state, then the central government can decree laws, right? It can make a decree that has the same weight as a law. Within that state of emergency, well, I mean, we issued more than 100 decrees, of which two were related to the health system. We have already made quite a few reforms of it, some of them related. So I talked a lot before about this service baskets specifically for the coronavirus, but it was not the only one. So we made changes. For example, now if you lose your job and maybe you're not poor, but you also do not have money to keep paying for health insurance, then the Colombian government is going to keep paying for that. We now are able and we have given money to public hospitals. We also made changes regarding, you talked a lot about the way in which we could pay those past debts. We made changes to that too. So we have made these these really little reforms of the health system within those a state of emergency. But I do believe that health insurance is the way to go, which is the core of the whole system, and I don't think that should change. but we'll see what happens in the future. I do not think reform of the core of the system should change. We are constantly tweaking the things that could be improved, but I think we have a sound health system. We think it's solid, and we think it gives, especially given our fiscal situation, we think it gives acceptable results in terms of health for the whole population.
The last question for the Latin American countries: how do you see the governments in the region dealing with public health next year?
Oh, so it's a difficult question because it would depend a lot on what happens with the virus. There have been some places in which, for whatever reason, the situation has appeared to spiral out of control. So if you remember the case of Guayaquil in Ecuador, you saw that the system simply was not ready to deal with that. So they should be looking into reform. Peru, I believe it has had, despite being locked down the longest, I don't think the handling of the virus has been correct. Brazil, I don't even want to talk about. The health minister resigned, then they put a military there that had no prior experience. It's been a disaster. But then you have countries where the situation has been really good. I think Uruguay has been excellent. In Venezuela, you can never know for sure what's going on. I don't know what's happening in Bolivia, but I just saw the minister explaining the coronavirus with the Avengers, and I don't think that's positive. I guess every country is gonna have to, when everything is over, is gonna have a really they're gonna have to seriously look how they handle the crisis, how their health systems are coping, and then they're going to be able to decide what should be changed or not.
Thank you so much for your time, Paul. I know that those are hard times and you have been working hard with the government. And thank you all, our listeners.
Thank you all for having me here. If you want to have a longer conversation some of the time, I would love to come back and, have a great one.
Thank you to all our listeners. Thank you again, Paul, for being with us. We talk about the healthcare system in Colombia and the challenge in the midst of the pandemic.